Live from SABC studios in Auckland Park, Johannesburg. Welcome to this week's last edition of the Watchdog. My name is Vuyo Mvoko, and on the show this evening...
No, no, no. Enough, it's enough on gender-based violence and femicide.
Calls for activism and vigilance as the 16 Days of Activism of No Violence Against Women and Children campaign kicks off. South Africans approve of the way the government communicated its COVID-19 messages to the public. But can the successes be replicated to other areas of South African life? Those conversations in tonight's edition of the Watchdog, which starts now. Women need to be empowered economically to ensure that they are less vulnerable. Well, that's the call and focus of this year's 16 Days of Activism of No Violence Against Women and Children campaign that kicked off at Nasrec today. This year's theme is socio-economic rights and empowerment to build women's resilience against gender-based violence and femicide. Connect, collaborate, contract. It's aimed at accelerating efforts to empower women economically as one of the ways to fight gender-based violence in our country.
Ushering in the annual 16 Days campaign with female-owned businesses forming the backbone of this year's initiative, hundreds of women-owned enterprises from across South Africa showcased their products and services. They believe the more women are empowered economically, the less vulnerable they will be to social challenges such as gender-based violence and femicide.
We believe that if women are financially independent and economically independent, they will have a voice.
Depending on the perpetrators, it's what makes us to be continuously abused, to be continuously being victims of abuse. So if we are able to fend for ourselves, then we'll be able to stand up for ourselves.
These business women also took advantage of the opportunities at the expo, especially to network. The country was reminded that women form the majority of the country's population at more than 50%, but only 20% are active in the business sector. Government believes this smaller representation of women in business has marginalized women and deepened gender economic inequality, which has a direct impact on women's vulnerability to violence.
Besides that, women in this country fought for freedom. They should gain access into the economic well-being of this country.
A call was made for men to embrace economically empowered and independent women. Men are also urged to speak up about the pressures they face and not to take their frustrations out on women and children.
The men must not bottle up. We see a lot of men hanging themselves, committing suicide. Let's talk to the men. We know that we've got a number of systems that can help people. Let's go to our pastors. Let's go to our social workers.
One, we are here to say we are sorry. We admit we stuffed it, we messed it up. Number two, we are here to say what now is the way forward. Because gender-based violence cannot only necessarily talk about violence against women. There is a lot of material and research showing that you also as women have also violated men, and most of the people are quiet about it.
The campaign will focus on various programs to create awareness on the scourge of gender-based violence and femicide. It will end on the 10th of December. Patricia Fasagi, SABC News in Johannesburg.
Victims of gender-based violence, including Tshegofatso Pule, were remembered at the launch of the provincial government's 16 Days of Activism for No Violence Against Women and Children in Soweto. In an effort to highlight the need for increased participation and engagement of men, this year's campaign was held under the theme Khuluma Ndoda, meaning Men, Let's Talk.
Community members gathered in Soweto to mark the start of 16 days of activism for no violence against women and children. Gauteng Premier Panyaza Lesufi reminded society of its collective responsibility to protect the most vulnerable. Alarmed by crime statistics released by the police minister indicating nearly 1,000 women were killed in the last 3 months, Lesufi says the provincial government's campaign will focus on the economic empowerment of women.
The only way we can empower people to fight against these monsters is to adhere to the theme of this year's 16 Days of Activism, that you need to empower women economically so that they can stand on their own.
Meanwhile, some school children lined the streets of Eldorado Park to mark the start of the 16-day campaign.
We create this awareness so that people can be cognizant of what is happening in our community. So it is entirely a case of everything being brought to, to fruition in this month over the next 16 days.
The Gauteng Premier has called on law enforcement officials to treat GBV victims with dignity when they report cases at police stations. Lesufi says police must be at the forefront of the fight against gender-based violence and femicide. More activities have been planned for the next 16 days. Balentle Mthethwa, SABC News, Johannesburg.
In KwaZulu-Natal, residents of the crime-ridden Umlazi township in Durban have called for street committees and community policing forums to be supported and capacitated. The global campaign for 16 days of activism kicked off in KwaZulu-Natal in Umlazi.
The launch of 16 Days of Activism of No Violence Against Women and Children commemorated amidst a dark cloud hanging in Umlazi. The area has been identified as one of the hotspots for conduct crime, with the highest recorded cases of rape and murder. 95 murders and 54 rapes were reported in the area between July and September. Locals say well-supported street committees can be a solution. She says now that the crime-fighting forums have been set up in their communities, they have to respect its work by supporting it and guard against those with bad intentions. He says street forums help a lot in terms of reducing crime in their areas. He says they also call on people not to wander around the streets during the evening. Government has called on the public, especially men, to be at the forefront of the fight against gender-based violence.
Police can never be able to deal with this alone. Prosecutions would never be able to deal with this alone. But it needs every member of our communities, every citizen, to stand up and be counted. Because if we do not do that, if we blame the police or we blame the prosecution, people are still going to, perpetrators are still going to go scot-free, because you're not putting the blame where it should be, to the perpetrators.
There's also been calls for survivors of gender-based violence to make use of the Tutuzela care centers found in some hospitals and police stations. These are a one-stop facility for victims of gender-based violence and femicide, with an in-house police officer, a nurse, a doctor, and an official from the National Prosecuting Authority.
We are a multidisciplinary team. We have on board with us such as SABC, who assist the survivors in opening the case as well as doing the consent, and as well as maintaining what we call chain evidence. And then we also have the nursing, which are assisting the survivors in terms of the pre and post counseling in terms of HIV, prevention of STIs and unplanned pregnancies, who also play a huge role in examination of the survivors when they are taken to the doctor for forensic examination.
government says it's planning to roll out the Tutuzela care centers across the province. Vusi Kumalo, SABC News, Durban.
Violence against women and children continues to cast a dark cloud over the province of the Eastern Cape. The province today launched its 16 Days of Activism campaign in Alexandria, a small town in the Ndlambe municipality. The town has a disturbing history of GBV cases.
Gender-based violence and femicide continue to wreak havoc across many communities in the country. In the small town of Alexandria, cases of GBV continue to rise. Activist groups in the community say many of the reported cases happen within households. They've called on government to strengthen the fight against the scourge.
The government should strengthen the law against perpetrators because they continue to abuse women and children. Those who are found guilty must rot in jail and never come back to society.
This year, we want to urge the government to consider setting up special courts for GBV. And also, we are concerned that we woke up to a young man who had killed himself after being falsely accused of rape. So we also want to urge the government to say that, especially the Justice Department, as well as the NPA, that any false accusation of rape should be considered for no less than 15 years punishment in jail.
The provincial government says a multi-sectoral mobilization is key in fighting GBV and drug abuse in communities.
The biggest challenge is the abuse of alcohol and excessive use of the drugs, etc. So all those problems are really messing up our community. And you can see the drug laws and all other people are becoming so emboldened because they are really making business which is destroying our communities, destroying young lives. Our young people are just stuck in this thing. So we've got to work together to uproot this problem of drugs in our communities as well as this abuse of alcohol.
Police have urged victims to report SABC members that turn them away when reporting GBV incidents.
Whenever there's a challenge like that or there's a complaint like that, it should be reported because we do have a standing order 102, 101 to address the complaints by the communities. And when it comes to complaints about gender-based violence, we take it as very serious. And even when it comes to the departmental steps taken against the members, the ones that are taken for failing to assist the victims of gender-based violence are taken very serious.
Over 13,000 women were victims of assault with intent to cause grievous bodily harm across the country between July and September 2022. Lwando Nomoi, SABC News, Alexandria in the Eastern Cape.
Let's talk about some of the issues raised in those stories, and to help us do that, please welcome Shoki Chabalala, who is the Deputy Director General in the Department of Women, Youth and Persons with Disabilities. Also part of this conversation is Nomasondo Mazibuko, the Chairperson of the Commission for Gender Equality. Good evening to both of you. Thank you so much for your time.
Good evening. Good evening.
Well, let me start with you. Shoki, if I may, empower women so that they don't have to depend on these perpetrators. No one can argue with that, but it is something, of course, that cannot be, divorced from the bigger problem of unemployment, poverty, poverty in South Africa. Is it realizable in reality?
Okay. Indeed, it is possible. It may not be that easy, but something possible can always be done. You will recall that the President launched the Women's Economic Assembly. It seeks to ensure that we have gender-responsive supply chain management or the supply chain value itself. But also we've had several companies coming on board representing the private sector with various captains of industry pledging their commitment to work towards the 40% policy pronouncement by the President. But government as well has done the same, and they do report back in terms of the achievement. We've also mainstreamed women, youth, and persons with disabilities into the Economic Reconstruction Recovery Plan of Government, abbreviated as the ERRP, with its pillars that seeks to ignite the economy. But at the same time, we're working quite closely with various sectors that are willing to come on board, whether it's the agro-processing sector, the sugar sector, the automotive sector. We've analyzed the sector master plans of government that have recently been approved. We applied a gender lens, we made recommendations, we participate in the economic cluster, we influence their policies, and we give regular feedback in terms of progress as they implement the National Strategic Plan. So we are believing that with the analysis that we have done, now that they are compiling or crafting their annual performance plans, they will apply that gender lens and they will ensure that issues of women, youth, and persons with disabilities are not trivialized.
But what are the report backs you're talking about? I mean, the analysis you're saying you continue to do. What are they telling us so far? Are we making any real, tangible progress?
There is progress, but a lot more can be done. I think we just need to put shoulder to wheel, upscale those interventions, but also build capacity, because some of the people, firstly, they need to understand what are the issues in their own sector. They need to be assisted to mainstream the National Strategic Plan into their own annual performance plans. But we've also ensured that whilst we are working on the costing of the National Strategic Plan, that they resource the implementation of the National Strategic Plan within their own baselines. We have a 21 billion that was committed over the medium-term expenditure framework, the MTF itself, and from that 21 billion, already we've spent above 50%. I think it's 51% that we've already spent. So I believe that we are making strides, but I think we can still do more and even faster.
Ms. Masibuko, I mean, this campaign kicked off today on the back of some horrific stats released only a couple of days ago. I mean, double-digit increases across the board, including, I mean, we're talking about what, 115 rapes per day in this country?
Yes, it's quite worrying that the stats, as they were released on Tuesday, they were alarming. But I think as the Commission for Gender Equality, as we are looking forward to monitor, we are looking forward to working together with other departments, and we are more going to monitor them. And what government has said, we would look forward to say those cases of rape, where do they happen? Why do they happen? So we should not wait until there's rapes. We should try and look forward to say, what is rape? How does rape happen? So we are working very hard as the Gender Commission to monitor that these rapes, how can we stop them?
Well, the Minister of Police, I mean, on the day he was releasing those statistics, Ms. Mazibuko was saying a big part of the problem, especially with categories like rape, is that they happen inside people's homes. I think policeable was the word he used, that it's difficult to police those crimes because they happen where police can't be.
Yes, Vuyo, remember that when a person is raped, it's always the case that the person who's the rapist is someone known to the victim. And we have found that as the Gender Commission, women will go to shepins and they would negotiate for drinks. And after they've negotiated, when their negotiations are not met, and the following day they will go to the police station and say, I was raped. And when we look further, it's because the negotiation part of the couple was not met.
Now, Ms. Shabalala, I'm keen to, I mean, at least you have the advantage of being in situations where police of course, together with other department or areas of the government, you are able to confide in one another. Are they able to take you into their confidence, to really be frank and open with you as to what their real challenges are in terms of their ability or capacity to be able to deal with gender-based violence? In other words, are there things that we may not be privy to, things which they have been able to share with you as their frustrations in actually dealing with this GBV pandemic?
Well, we've never had an opportunity to take that line of questioning, but what you would normally hear from them when they just talk about what they would like to see government doing in improving services on their part is that, and it happens across the board, it's just not the police. You go to social workers, you go to educators, they will all tell you they need more capacity on the ground. They need more men and women in blue so that they can have sections and divisions that can be dedicated and be focused in dealing with these matters. Not that those sections are not there. I mean, right now they have desks that they have established, GBV desks that they've established. They are training those police. We just looked at the kind of training programs that they are offering. It's around issues of diversity, victim empowerment, human rights. So there is ongoing training. Perhaps an area that we need to strengthen more is how regular do they get subjected to debriefing sessions so that they too are not, burdened with the whole issue of having to deal with these matters on a daily basis, because the incidents of reporting are high. And that area is one area that we believe we need to look more at it, even if it means we bring civil society organizations to assist in this regard when it comes to the issues of debriefing.
Ms. Mazibuko, as a Chapter 9 institution, do you feel that you are able to influence not only or just policy, but also critical interventions that need to be made?
Yes, I think we have, as the Chapter 9 specifically, the Commission for Gender Equality. As it is, from last year, we have been going to police stations to monitor, and the advice and what we have said to police is not to judge the victim, take time, let the person sit down, and the victim must be taken to a special place where they can talk freely. And we have found that police themselves say, go and solve the problem with the perpetrator. The police themselves would say, even if they have to go and find the perpetrator, there's not enough transport. And the capacity of the police station is much to be desired and to be looked into, because you find the police stations are under. Not enough police are there. For instance, when we come to the night shift, police stations are not capacitated. Human resource is not enough, specifically where you find they have to go out and find the victims. And as they talk to the victims, they try and not get into the facts. They say, go and solve it. What were you wearing? Where were you at that time? So they must calm down. And we find that it is when the police are not capacitated, and when we find that the people themselves will say to the police, we have had a minister saying, you don't have a right to be the judge. Listen to what the person is telling you.
Just out of interest, from those, capacity issues, have been with us, for the longest time. The sensitivity with which police should be handling these cases is something activists, everybody has been talking about for a while. Keen to know whether from those road shows, when the visits that you made to these police stations, whether you discovered perhaps other things that are perhaps impeding the fight against gender-based violence. Did you make any new discoveries? Did you get an appreciation that perhaps you didn't have before you visited these police stations across the country?
What we have discovered is that the rape case, kids take a long time. So people themselves and the police themselves don't have the results. And the issue of not us working together with the victims and the perpetrators is to say the perpetrators are seen being given bail. And then what we find out is that the victims live in fear, and the parole system has much to be desired, because if a person gets parole, the person who gets parole comes back and do the same crime. So it means we are working together. Still, those people have got rights for you, and they will be given bail, because bail is a right, and they will be given a parole, because parole is a right. But what we have seen as CGE is that we've got the courts that the president has opened around the country. So those courts still cannot do anything without the DNA reports of those people.
Mr. Walala, this, of course, being a UN-driven campaign, are you privy to any research or information as to how other jurisdictions, other countries around the world who have made significant strides in the fight against gender-based violence, whether what it is that they have been able to, if there are any, sort of perfect examples of how one or a country can wage this fight or this struggle, how they have been able to do it, the kinds of things that they do to make a difference.
Okay. The laws have been improved. Like in our case, we were asked to have law reforms. And in this instance, we work on the 3 GBV bills, which have now been assented into law. But what we have realized as well is that we need to strengthen the entire criminal justice system, because it's a value chain, starting from the police up until court systems and all of that. What we have realized is that for as long as you don't redirect resources to prevention, you are more likely to react in most cases. Like we are doing right now, most of the time we are funding more of our programmatic interventions that are not proactive but mostly reactive. We now have a prevention strategy, and it seeks to propagate for redirecting of resources to more intervention programs, targeting the boy child at a very tender age, not leaving out, of course, the empowerment of the girl child. So in that way, it helps us to turn the tide, because if you were to look at how we're funding, like you take a pyramid and turn it upside down and probably divide it into 3 blocks, the small block below at this stage, it's where we are in terms of prevention. And we are working towards turning that tide to say, we should take charge, and as government, we should make more calls for proposals for prevention programs, and we should direct more of resources to prevention as opposed to what is currently happening. But also bring in more men on board. We can't afford not to work with men. There's men that can assist us in tackling the scourge and deal with issues of toxic masculinity. We appreciate what the Premier of Gauteng did today, together with the leadership in Gauteng, and what even the Premier of KZN they've been doing today. For as long as we don't bring men to the epicenter, we are not going to win this battle. They are partners and they need to walk this path with us. We also need to bring media to the party, because if you don't come in, not only to make us account like we are doing now with CGE and government and all, but you too tell us, how are you going to support us? What is your programmatic intervention, so that collectively mainstream media can say this is the contribution that we are making as well, because the NSP is quite clear. It spares no one from implementing it, but it also seeks to harness all resources. So we need to all pull together in one direction. I think we can possibly tackle this sketch successfully.
Ms. Masuko, I mean, Ms. Shabalala there talks about, the media and, of course, the need for all of us to pull together. What's your sense, though? Are we making use of, available, levers to make a difference?
I think we are going to make a difference for you. But South Africans have a tendency of working in silos. It is for us, government, Chapter 9 institutions, as Mamshoki said, the media. Let's work together. Let's not find fault. As CGE, we've got reports that we have given. Even the police, we have released our reports of visiting police stations. But the police themselves should not find as if we are fault finding. They must, after we give a report, they must know that we are saying, this is the weakest point. Let us come together, work together, and go forward. Because the police themselves, the CGE itself, the Department of Social Development, when we go to the shelter, they must know that we are saying it is working together that will make us find the sketch. And the most important part, we cannot go afar without the men, without the boy child. As we find today, the children are not working together from the classroom. So families must come together and give the instances to say, this is not going to happen. And if we are not going to have conversations from the home to the church should play a very important part where we talk about issues directly to the youth, and not leave them to be victims.
If I
may come,
yes, please.
Sorry, if I may come in there. Firstly, let's appreciate the interventions by the Commission on Gender Equality, visiting the police stations as well as our shelters and coming up with a report on their findings, because that report also highlighted some of the gaps or areas of development. But the good thing about it is that government has been receptive. SAPS acknowledged that there are areas of development. For instance, you established that there are police stations without victim-friendly rooms. I think there are about 137 or so, if not 139. And SAPS came up with an action plan, and they will be building those victim-friendly rooms within the next 3-year period. So that on its own, it's a demonstration that they are realizing that you play your role as part of doing your oversight, but also they need to accept whatever findings and recommendations that are there and put remedial interventions or plans in place. Similarly, with social development, they are also working on their own action plan. I am informed CGE, you provided them with a template, and they're accounting probably on a 6-monthly basis and providing those reports in terms of progress. So in that way, like I'm saying, we are gradually pulling towards a common direction and making sure that we are all held accountable and we report and respond as expected by society, including civil society, by the way. It doesn't mean civil society is not supposed to account. They too should account. They receive money from private sector, from government, from donor funding, development partners. So they too are supposed to account. However, we have acknowledged that we don't have an accounting framework for them, and we are going to work on that part so that as we account as government, they too take their share.
Let me thank both of you for being part of this conversation this evening on the back, of course, of that formal launch today of the campaign 16 Days of Activism. Ms. Shoki Chabalala is the Deputy Director General in the Department of Women, Youth and Persons with Disabilities. Namasondo Mazibuko is the Acting Chairperson of the Commission for Gender Equality. After the break, communicating the government's message, wonderful lessons learned from COVID-19. The government may just have found that, shall we call it, magic wand in how to communicate or convey its messages to the public. That's if the approval rate of its handling of the COVID-19 pandemic is anything to go by. 74% of South Africans believe the government handled the pandemic well, a very high approval rating considering a generally held view that the government is poor at communicating with citizens. So what did the government do differently this time around? And can it be replicated in other areas of our lives? Well, to talk us through the survey that produced this result is Tasneem Karim, the Chief Director of Policy and Research at the Government Communication and Information Systems, GCIS. Also part of this conversation is William Bird, a Director at Media Monitoring Africa. Good evening to both of you, and thank you very much for your time.
Good evening. Thanks for having us on the program.
I'll start with you, Tasneem. Take us through, how you conducted this survey and with what purpose in mind.
Okay, thank you very much, and good evening to your viewers. The survey that we're talking about was conducted numerous times during the whole pandemic. We used it right in the beginning to see if the messages were on track, they were reaching the right audiences, and what we needed to do to adjust the messaging. So the surveys were used to tweak the message if need be, and also to adjust the communication a program towards areas where the messaging had not reached. So the survey is something that GCIS conducts on a regular basis, and it was part of a whole host of things that we did, which has been put into a book that we launched today. And that's why I'm here today, to talk about the survey and other things. Just to say, what we did find was early on, the message recall was pretty high, but slanted towards urban areas. And that helped us to ensure that we moved communication spending to rural areas, but also that what we did is we spoke to the messaging that appealed, that resonated with people. And for example, one of the questions we asked people is, why are you complying? Why are you wearing masks? Why are you sanitizing your hands? And they said to protect themselves and others. And this was then the messaging that became the predominant messaging under the COVID campaign.
I'm sure, it'll jog our viewers' memories if you just remind us of what those messages were at Tasneem and how they were communicated to the public.
Okay, so I'm sure many of us want to forget that in February 2020, just after the president delivered the State of the Nation address, and we had a clear plan on how government was going to implement its policies, our world was turned topsy-turvy with the outbreak of the pandemic across the world. And in this state of uncertainty, the president and the cabinet were quick to declare a national lockdown at stage 5, a level 5. And at that time, the messaging was around staying home. So we were calling on people to stay at home. And then at that time also, if you remember, we were asking people to wash their hands with a sanitizer, with a proper sanitizer, how many times they should wash their hands, what they should do to protect themselves, what kind of clothing they should wear, what they should and shouldn't touch, and the distance they should keep from others, and how they should behave if they went out, and what they went out for. So at the beginning, there was all this uncertainty, and all that we knew, the scientific community knew, is what we were communicating at that time. And then, of course, as the levels went from 5 to 4 to 3 and sometimes back to 4, the messaging shifted. And as more information became available about what was truly dangerous, for example, ventilation became an important part of the messaging, then the messaging shifted accordingly.
Something very interesting for me, William, I mean, from this is a paragraph or an area like what came out of this with regard to who were the most trusted sources of information about COVID-19. The approval rate when it comes to health professionals was 80%. Health experts, 78%. World Health Organization, 75%. The president, 75%. The government, 75%. The Minister of Health, 66%. In other words, you have South Africans trusting professionals more than they trust the government and politicians.
Well, you know, I mean, politicians at the moment don't exactly have the best reputation, I think, globally, broadly speaking, you know, so I don't think that is altogether too surprising. But let's remember that when this pandemic broke, it was just shortly thereafter we had the digital vibe scandal. And so, in fact, there was a significant gap in communications coming from especially the National Department of Health. There was a significant pause where people just had no idea, and a lot of those gaps were then filled by a lot of things that were frankly dangerous. We had a significantly high level of mis and disinformation. But I think, to government's credit, one of the most positive things that occurred over that period was the fact that everyone said, we need to work together on this. And you saw, certainly for the first time that I can recall in over 20 years working in the sector, government working with private sector, with academics, with experts, with NPOs, with civil society, to say, what can we do to address all of these things? And you suddenly saw all of these various people coming together, ramping up, particularly around communications. You know, you even saw mobile operators coming to the party, giving out data, making sure that government had access to certain kinds of information that ordinarily they wouldn't have. So you saw a lot of effort coming together to actually work through these things. The second thing that I think was really critical was that our government, unlike many others around the world, Donald Trump, let's remember, go back in time to that crazy period where you had the President of the United States talking about swallowing bleach, you know, as a method of killing the virus from the inside out. You know, literally completely and utterly mad stuff. And to our government's credit, what they did was they said, what we're going to do is follow the science. Of course, you know, errors made along the way and those sorts of things, but that does explain why those people reflected in that survey were received high levels of trust, precisely because, you know, as things broke, we saw our country's experts talking about these things, explaining them. You know, initially that wasn't done very well because you had some of the best doctors explaining things as though they were talking to their fellow doctors, and as members of the public, you're sitting there going, I'm not quite sure what Professor Mahdi, as an example, is saying here exactly. And you saw that quickly government had to scramble to say, okay, actually, these things ordinary people can't understand. But what that did do was it said, we're getting in experts to talk through this thing, to unpack, to help us understand what's going on, to give us the best kind of scientific evidence and advice we can possibly rely on in order to address this particular pandemic. And that's what they did. And they were pretty consistent about that. As I said, I think aided and abetted by, a huge number of people, including and especially the media. Let's be clear, one of the biggest players in this that helped government ability to communicate was the fact that almost all of the media came to the party in a significant manner, including the SABC. SABC was there putting out public PSAs. They were there putting out content that was coming from, all range of players. They were putting it out and fulfilling their public service mandate. And again, if you want to make sure that people have accurate, reliable, credible information, the way you do that is you put out a lot of accurate, credible, and reliable information.
Of course, we were, criticized by, a lot of skeptics who felt that we were promoting and advancing the popular narrative around this pandemic, William.
Well, there were a lot of people, and there still are a lot of people who were, COVID denialists, if you look at the kind of forms of mis and disinformation that spread in the lead up to it, and as it went through, every time new breakthroughs occurred, then the kind of mis and disinformation would shift to speak to that. And because at that stage, then government had already got, a social listening group working together with, again, across departments. So it's really showed what people can do if we actually do work together. It's a really lovely model of what we really should be doing on an ongoing and consistent basis. But of course, you're going to get skeptics. Bear in mind that a lot of these people that were skeptical and just pushing out active misinformation to scare people were being funded by, sources from outside the country, in many instances coming from the States, as an example.
Of course, Tasneem, your document does also acknowledge or admit that in no small measure this success was also due to the fact that government partnered with civil society and business, as William was also pointing out.
Yes, thank you very much. Indeed, because when we found ourselves at the beginning of this pandemic, heading up a communications campaign that needed to reach 60 million people, and we didn't have a budget for it, we had no resources for it, and we had a lot of pressure from everywhere. That's the thing that came up, and in fact, it's quite poignant that William is talking about 20 years ago, because when I first made the call to Tim Schultz from B4SA to suggest this partnership and to start this partnership, what I remembered was the way in which we had partnered across sectors to make sure that the World Cup in South Africa was a success. And we wanted to mirror such a partnership. And what was amazing is that in a few short days, we made the contact with Business for SA, and civil society came on board in a big way, represented initially by Mabelani Mfundisi. And so did COSATU, Solidarity, a number of trade unions. The Consumer Goods Council came on board in a big way. All the retailers came on board. And our approach was, we know that we had content, and as fresh as the content was that was coming out from the scientific community. But we also knew that, the private sector or civil society wouldn't want our branding. They wouldn't want our packaging. So the approach we took is that it should be one message, many messengers. And that's exactly what happened. So we would bring the message and everybody would take it and they'd package it for their different audiences and it would get out there. For example, the Consumer Goods Council, all of their thousands of members just basically took the messaging and put it on to their boards outside their shops so that we could spread the message as much as possible. And I think also William speaks to a very important point. Even with the criticism that you got as the SABC, I think the SABC played a critical role, and so did the rest of the media. If I can remind you, I'm sure everybody watching this program can remember those first few days when we would have media briefings, live media briefings from GCIS head office, and they would go on for hours because there was so much information, so many questions the public wanted to know, and most broadcasters took that press briefing live and at no cost. So, you know, I think it was the SABC that played the primary role, but so did other media. So the media were definitely our partners. And then also just to say, you know, the social media partners, I mean, Facebook, WhatsApp, Google, all came on board into this partnership and helped us spread the message. So, you know, when we segmented our audiences, and we knew those who had access to the internet, they helped us spread the message to them. But the other thing that we did, interestingly, just to quickly finish, is that you may not know that those people who didn't have access to the internet, we bought loud hailers, smart loud hailers, got onto donkey carts and rode through rural areas to spread the message. And so just so that we could make sure we could reach every South African.
Of course, I mean, William, I mean, this was a pandemic which required extraordinary, you know, efforts to be made, but you know, and probably was, I mean, probably, but it was definitely an expensive thing to do and manage as well. But generally speaking, there's this widely held view, I don't know if it's scientific, that you know, the government is poor at communicating with citizens. I don't know whether from where you sit, you think there are perhaps lessons to be learned from the way this pandemic was managed that could then be extended to, you know, generally how we, the government conducts its business on a day-to-day, but also one thinks of situations like your unrest that broke out in July last year in parts of KwaZulu-Natal and Gauteng, and how that was managed. Just your thoughts as perhaps as a last point.
So, you know, I mean, it's a lovely point you're making. And of course, you know, I think often governments, like media in many instances, are their own worst enemy at communicating the things that they are doing. If you look at our current load shedding crisis as an example, right, what we get told is, well done, we're now on load shedding stage 3. Well done, we're now on 2. We're now on 4. We're now on 5. Oh, this is broken down, that's broken down. What we don't get from that is what on earth is going on and what steps are being taken actively to fix and remedy the situation, right? And that's, if you look at this thing, and that's similar to a pandemic in that it's not an immediate burning crisis like the July 2021 unrest. This is something that's an ongoing kind of crisis, and the manner in which many of the issues related to that are being communicated aren't anywhere near adequate, sufficiently adequate, I don't think, you know. And so if you look at that and you say, well, what lessons should we be learning? I think one of the key things from this was that it was about ongoing and sustained partnerships. It really worked off the goodwill of so many people who donated immeasurable amounts of their time and expertise to actually work with government. And it showed what you can do when these people come together and do. I mean, it sounds corny. Come together and we can make, you know, many hands make light work. All of those things are true then as they are now, as opposed to something like an immediate burning crisis. I think, you know, we've put forward suggestions as to one of the things that needs to occur when that happens, when you get some kind of a crisis like that, because again, as we saw from that, there were many issues that I think that, you know, we simply weren't good enough as South Africa, as the media, we weren't ready. It took media ages to get there. Many of them didn't have resources there at the time. So, you know, violence was breaking out, and we were following a lot of that on social media well before we got any journalists there to actually credibly verify what on earth was going on. So, you know, there are a lot of lessons for us, all of us there around that. But I think that if you look at it, some of the lessons we are trying to implement, others, I don't think that we've learned our lesson. Look at load shedding. You know, it's nowhere near sufficient in terms of the kind of communication that we're getting. You compare that with the pandemic, where there was efforts, as Tasneema said, Hours and hours spent explaining what on earth is going on, explaining the science.
Okay.
But we don't get that in relation to load shedding. We just get going, we're up and down, and we're using diesel, and we've got some diesel, and it's like that doesn't help us understand the problem. It doesn't tell us what's being done to fix the problem.
Okay, unfortunately our time is up. Let me thank both of you for coming on this evening. William Bert, Tassim Karim, thank you very much. So that's our show for tonight and for this week. Do have a good night and a great weekend till we meet again on Monday.